Well, that's amazing to hear. Well, I think it's excellent to hear that we have such a good person to take care of those in the area. So thank you again for that information. I think there's something I'd like you to kind of share, because I know that we've all talked about this special rehab devices we use and things like that. I know you just recently you did a couple patients with your fractures and this new machine, the Rebless, which you've also done with your elbow patients. Again, still working on, outlets for it and insurance things and everything else. But will you tell the viewers, they've probably seen your insane surgery you did on the elbow of that kid, that every part of their body was stuck, and you've been able to find ways to offer. Probably you're one of the only ones in Washington I know that's hand surgeon that has this opportunity. So it's pretty amazing to have this device. Tell us a little bit about your sort of experience with it and how it's helping your patients.
Again, I'm a huge believer in motion. And if we can fix fractures and fix ligaments in a way that we can get them moving as quickly as possible, then we have the opportunity, I think, to really get out of the gates running quickly. And with this new Rebless device, I think it's awesome. It's just, again, it's all about movement, moving people quicker. And the great thing about it is that because we can monitor our patients remotely now, it just makes us be able to really dial in people's therapy protocols basically on a personalized level. It used to be that we would, make physical therapy prescriptions, and it would be, one size fits all, and sort of like our thumb surgeries that we're trying to really individualize to the patient. This device allows us to individualize patients' rehab protocols right from the get-go, and it's so scalable in that there's so many variations that we can tweak with this device, whether it's just simple passive range of motion versus active and active assist range of motion, which means just moving the joint versus actually having the patients fire the muscles and start their strengthening protocols. And it's so adaptive. I mean, you can use it in the knee, you can use it in the elbow, we've used it in the wrist now. So it's really, I think, again, very exciting to be an orthopedic surgeon in this day and age, because we have so many better tools that we can provide to our patients, and we're getting such better outcomes than we did 20 years ago.
Well, and I think the important thing that the listeners need to hear is that, we talk about all orthopedics, all sports all the time, but it's more than just the surgeries, right? And I think Will's seen this before, where there's lots of things that we are non-surgical we treat, but also in the surgeries, it's not just the surgery. That's the part that everyone finds is sort of the sexy, glamorous, technology-driven, but really it's the post-operative is very important. And as you heard from Dr. Rell, he does an amazing surgery, but if that patient doesn't move, they don't look good.
Yeah.
And so he's talking about ways to accelerate everything. And so when you do that, that's when you have patients rocking it in the office at 6 weeks. And so having the device plus the good surgery plus accelerated rehab, it's a combination. And so, Will hears us talk about this all the time, but it's not, we're orthopedic surgeons, but we also specialize in orthopedic post-operative care. We specialize in preoperative evaluation. It's not just doing the surgery. We love the surgery part, but I also love good outcomes. And so the key here is with seeing with Dr. Wild, the same thing. It's just continuing, how can we fix it at every level? It's a supply chain, kind of machine system we have to have, but you got to make sure that every part's working correctly, or you're not going to get a good outcome. But if you do it correctly, you get good outcomes appropriately. So.
Yeah, and it's a good reminder also. We had talked about this on one of our other shows about technology and biofeedback, and you're talking about this Rebless, right? That was that Robotics one that we talked about.
Yes. Please look at our previous episode to learn about it.
The physical therapy device for both upper and lower extremities. And Dr. Weil said it perfectly, right? The elbow, the wrist, the ankle, knee joints. So as a patient, right, as someone that's going to come into your office and have something done, and knowing that, okay, that's step one. but now what's the next step to get back to having some normalcy, right? To get back to doing the things that we want to do, whether it's, you know, grabbing my coffee mug because my thumb is now fixed and I'm, you know, getting treatment, or, you know, going for a run because now my knee is fixed. So from the surgery through the rehab and having technology, that's really exciting for us, but I know for you guys too, because it's like new toys. So it's really exciting.